No worries. My name's Rob, and I work at a major metropolitan hospital in Melbourne.
Awesome. So Rob, can you just tell us a little bit about your internship experience in nursing?
Yeah, so it was. I started in 2020, so it was very much disrupted by the pandemic, as you can imagine.
Yeah.
Um, Many of my hospital assignments had to be rescheduled, or some of them were cancelled altogether, or they were cancelled halfway. So it made it a bit difficult that way to sort of get that continuity. Um, and it was just a challenging time in general because as a student nurse, you're expected to work full time hours, but then when you get on the actual job, the majority of nurses actually work part time. Um, so when you're completing unpaid full time work alongside study, it's challenging but rewarding at the same time.
Yeah, for sure. And in terms of the internship, how well do you think that prepared you for a career in nursing?
Well, I remember this isn't an uncommon thing, but for nurses in general. But I remember when I was starting, feeling extremely anxious and not feeling ready at all to start my shifts as an independent nurse. But in the context of the pandemic, I did feel fortunate that I got some experience on some very good wards. One of which I ended up working at for 6 months when I did get my grad year. Uh, uh, However, talking to other nurses, experiences do definitely vary from student to student. One student can be put on a ward that they absolutely hate and it sounds horrible. But then, some people have uh, really good experiences with their ward. So it varies from person to person. Some placements are also less clinical than others. They're more like outpatient clinics where you're in more of an office setting, and then others are on the floor, getting the experience that you're most likely to use um, when you're on the job.
Yeah,
So, did I feel prepared at the time? Probably not. But looking back, I think my experience compared to a lot of other people was probably better than most.
yeah. So it's obviously very dependent on the hospital that you're at.
Yeah.
Given that many internships, I know in journalism, but especially in healthcare, are unpaid, how did you manage financially, Roberto?
At the time, I was very lucky. I did have a casual job, but it was very flexible when it came to placements. I would just put that off for a little while. I was also living with my parents at the time, which made it a lot easier. It's such a tough time when you're on placement, and you're adjusting to the full time schedule. You've also got uni assignments due. It's also obviously just a challenging environment to be in 5 days a week, especially if you're not used to being around sick people all the time. So I'm very grateful that I had a supportive environment around me while I was going through it. Um, because if I didn't have that, I might never have got into nursing to begin with. So
Yeah,
yeah, it was challenging, but I was very supported.
yeah, awesome. Um, this one's a big one for me. Did you ever feel that your work as an intern was undervalued, that you were being asked to do tasks that were typically reserved for probably someone who's a bit higher up in your position?
Uh, Not necessarily. I obviously know that in similar roles in other industries are paid, but it never even occurred to me that I should be paid for the job I was doing just because it's almost like a precedent. It's just a well known thing that you don't get paid for doing student placements or student internships.
Yeah,
So it's just something that never particularly occurred to me. That being said, like I said earlier, was very supported. But then I'd look at other members of my student cohort who were, with families or had really long commutes from one side of the city to the other, catching public transport. So, and I'd think, how is this normal? How are these people even, um, surviving? Having all other responsibilities, having some of them full time work alongside their placements. In terms of being asked to do additional tasks, I've heard of it happening, but I think it's quite rare. It's very tightly controlled in healthcare because obviously the safety aspect of things. So our university has a scope of practice that they provide to us and to the hospitals before we go on placement, that outlines everything that we're allowed to do. Um, and they often outline as well what we definitely should not be doing. So it's, yeah, obviously it's a risk to the patients, it's a risk to the staff at the hospital of potentially getting in trouble if something does go wrong. And then it's also a risk to the student who may, if they operate outside of their scope, uh, be not allowed to finish their placement. So it's very well regulated, I suppose.
Yeah. Awesome. I know personally I have a lot of suggestions for the journalism internship, but what are your suggestions for nursing internships and how they can improve in Australia?
I think something that I'm sure there's a lot of things that can be improved, but something that was quite noticeable to me when I was hiking out to Bandura was that I felt like I was coming a long way when I had a half-hour commute, but then I'd have other people on my placement who were coming from Werribee on the other side of the city,
Yeah,
catching public transport, which takes over an hour to do so. So I think if there were, I don't know, something in place to make sure that, or to, yeah, to make sure that placements were as close as possible to the individual student, I think that would go a long way because, like I said, when you're, you know, you've got life going on, you've got other jobs, you're also having to do full-time placement hours when you've got to get up at 4:30 in the morning to try and get to your shift after maybe having a nine o'clock finish the night before. It's just not a safe thing to be doing, I don't think. So that's one way I think that things could be improved.
yeah.
Um, yeah,
Awesome. All right. Well, that's all I've got for you, Rob. Thank you so much for chatting with me. Really appreciate it.
no worries, Tom. Thanks for having me.